Talk to us about the idea here, the driving premise of Summer Health.
Yeah, thanks for having me, Emily. The idea behind Summer Health is a very simple one. We believe that all Americans should have a phone number they can text and get an answer staffed by a doctor within 15 minutes for any of their medical needs. This started out of my own needs as a mother, so we're very excited to launch Summer Health today.
And you're focusing on pediatric care. Why is that? I mean, the idea that I could just reach my pediatrician in minutes is totally novel and kind of amazing, but it also seems like a moonshot.
Yeah, I mean, it sounds like you as a mother may have also experienced this. We're starting in pediatrics for many reasons. Two of the primary reasons are that parents are thirsty to get more medical attention for their children. There is no shortage of parenting questions that come up around health and wellness that parents wish they could ask a pediatrician, but because pediatricians' offices tend to be overworked and sometimes, unfortunately, understaffed, they have nowhere to turn. The second reason is we want to give more access and resources to pediatricians who want to work more. We have learned through starting Summer Health that 1 in 5 medical professionals is planning to leave the industry in the next 2 years, according to the American Medical Association. And anecdotally, in pediatrics, it's far worse. And so we know that pediatricians are looking for alternate ways to practice medicine. We believe that Summer Health is a great way for them to do so.
Why is that providers are leaving and that it's worse among pediatricians?
COVID was tough for everyone, most notably physicians. Physicians have been overworked, understaffed, put through the ringer because of COVID. They also have not necessarily benefited from the ability to work from home the way a lot of other professionals have been able to do. And so many of them are now turning to professions that would allow them to work from home. And in fact, Summer Health, you don't even necessarily need to be face-to-face with a doctor. Your provider can be at her child's soccer game. In particular with pediatrics, pediatricians tend to be disproportionately women who, as we know, have been affected by COVID and lack of childcare resources. 25% of them are part-time and so look to fill the rest of their time with other pediatric work. And we believe that Summer Health is the best platform for them to do so.
Amazon acquired One Medical last week. There's a lot of stuff going on in the telehealth profession. What do you make of that move?
We've been following the news very closely, and we believe it's a boon to the telehealth industry. When a large, very credible player like Amazon comes into the space, it's very legitimizing for the telehealth industry. So we view it as positive, not only for patients, but also for the industry as a whole.
So, there are a lot of patients who are potentially concerned about Amazon owning this company, concerns about how our data, for example, is going to be used. I mean, how can we be sure this is definitely moving the industry in the right direction?
Yeah, again, we think about this a lot. There's such a thirst for more medical care. Our health system today is mostly reactive. It's still mostly done in person, and it's not necessarily servicing the broader needs of patients. But what we learned through COVID is that 88% of Americans have accessed some form of telehealth in the last 2 years. And 77% of clinicians have expressed that telemedicine can actually drive better outcomes for care. So we know that the industry is poised and ripe for this kind of modality. I'm fairly certain that Amazon will abide by the regulations around PHI and sharing of information. But broadly speaking, when we see larger players coming into the space, I would not be surprised if Google and Apple and some other companies start to play in this category. We see a net positive for patients who can access doctors faster.